Right, so as part of Breast Cancer Awareness Month, we're continuing the conversation around early detection because it saves lives. This morning, we're getting a practical lesson in self-examination from oncologist Dr. Jason Copeland. He's from Breast Health and Oncology Care Center, Jamaica. Hi, Doc. Morning. How are you?
Morning, Simone. I'm good. Thank you for having me.
See you. Maybe leave another message. Take away yourself.
Absolutely.
Take yourself away. In this age where we are developing so much technology to detect and to, you know, just last week we had somebody here with a new type of machine that does 3D scans and all the rest of it. You're saying, Doc, that self-checks are still key.
Yes, the breast self-examination is still critical. It's one of the 3 pillars that we use when it comes on to the early detection of breast cancer. Now, for us in Jamaica, that is extremely important. Now, 40% of our patients who present with breast cancer actually are presenting with what we call locally advanced or stage 3 breast cancer.
40%?
40%. And this is a study that we have conducted, and we found 40% of patients presented with locally advanced breast cancer. Now, what we want to do is to be diagnosing these patients at a much earlier stage, such as a stage 1 and a stage 2. Now, that will actually...
Is there a stage 0, though?
There is a stage 0.
What is a stage 0? I heard somebody talk about it and it's like, what?
Yes, there is a stage 0. Now, that's referred to as ductal carcinoma in situ, DCIS, or non-invasive breast cancer. And that's the type of breast cancer that we typically pick up on screening mammography. So when you screen, we're actually able to pick up that breast cancer at a much earlier stage. And patients who have this stage 0 breast cancer, once you're treated adequately, actually have a normal life expectancy.
Oh, wow.
So that's where we want to pick up breast cancer ideally.
Okay, but so 40% present at stage 3. We do not want that.
We do not want that. And as you mentioned, the stage 0, about 4 to 5% of our patients present with stage 0. In other countries, like North America, Western Europe, they're at 20 and 25% of patients with stage 0. So that's where we want to go with screening.
Well, then tell us how we get there. We need to be checking ourselves.
Yes. So this, I can go ahead and demonstrate the breast
please.
self-examination. So I'm going to take this off for this mannequin.
Okay. Sorry, lady.
Yes.
We don't mean to, you know, but for the purposes of...
So this mannequin actually demonstrates a patient who has had a right-sided mastectomy, which is one of the surgeries that we use to treat breast cancer in Jamaica. Not the only surgery, but one of.
And mastectomies
removal of the
Yes, removal of the breast. When does this usually typically happen?
Well, so those patients I mentioned who present with stage 3 breast cancer, typically that's the sort of operation that we'd have to perform. Now,
so that it doesn't spread. Is that it?
Well, correct. But so patients who present earlier, for example, stage 1, stage 0, stage 2 breast cancer, these patients can get what we call breast conservation surgery, where we're able to remove the tumor without removing the entire breast.
Gotcha.
And very often these patients get radiation afterwards.
Gotcha.
But typically for stage 3 patients are very often treated with mastectomies.
Gotcha. Okay.
So the self-breast examination is one of the 3 pillars for early detection. The other 2 includes clinical breast examination, which is done by your clinician once per year. And of course, the other one is mammographic screening. Sometimes we do add breast ultrasound. Sometimes we do add breast MRI for persons who are at a high risk of developing breast cancer.
Let's be clear now, Doc. Your mammogram should be done when women hit what age?
So the first thing actually is to understand the risk of that individual.
History?
Yes, the risk. So now, if you have a strong family history of breast cancer, for example, if we look at your personal history, reproductive history as well, and we actually give you a score. Now, if that risk is high risk, we actually start your breast cancer screening much earlier. We start at age 25.
25?
25, and we use breast MRIs, and then we add mammograms at about age 30.
Okay.
So that's for high risk. Now, if when we do the risk assessment, your risk is what we call an average risk, and for us in Jamaica, that means lifetime risk of 1 in 15. So 1 in 15 women in Jamaica will develop breast cancer. Now, if you're at an average risk, we start breast cancer screening at 40, and we use mammograms every year, and sometimes we add breast ultrasound, especially if the breast is dense.
Did you say 1 in 15 of us?
1 in 15. So we used to say 1 in 20 or roughly 5% lifetime risk.
How old is that in Doc?
It's 1 in 15 based on the newest data from the Global Cancer Observatory.
But your survival rate can be great if you catch early.
That is
Let's
correct.
Go back.
That is correct.
Let's self-check.
All right. So the breast self-examination has 2 components. There's a visual component and there's a feel or palpation component. So for the visual component, we recommend that you have a standing mirror. So you stand in front of the mirror and you want to raise the arms up and down. So you want to look at your breast in different positions to see if there are any changes in terms of any asymmetry Any lumps you're seeing on one side that's not on the other side, any redness, any rashes. And you actually, arms up, and you turn one side to the next side while looking in the mirror. Arms at the side, you may squeeze a little bit to contract the muscles. Similarly, turn one side while you're looking at yourself within the mirror. Another important thing to do while you're doing that is that for some women, as you get older, there's a bit of ptosis, or the breast becomes a little bit drooping. You have to lift up the underside of the breast so that you can see in the mirror what is underneath, because you can miss disease process going on under there. And you do that on both sides.
And what would you see under there? Same lumpy?
Yes, you may see thickening of the skin. You may
Gotcha.
see evidence of a lump or an ulcer.
Okay.
Some of the early changes.
That's under here.
That is correct.
Okay.
Now, the second component is the feel, or the palpation component. This, a lot of women do this in the shower, which is fine. Again, usually you're standing. And so, for example, with this mannequin, on the left breast, you're going to use your right hand. So you're going to raise the left arm up, and you're going to use the pad of the fingers, the 3 fingers here, and you're going to start and go in a circular manner all the way around. And you go towards the armpit, what we call the axilla, to check for lymph nodes as well. And then you continue around and around and around. Very important as well, not to neglect the nipple and the areola.
Right.
Because about 10% of breast cancers will present underneath the areola, which are called central breast tumors. So you also palpate there as well, all the way around, and then a gentle squeeze on the nipple. For the right side, you're going to use the left hand and repeat the process.
I love how you say under the arm is very important, because some things can present there. And then we only have a couple of seconds. Discharge from the nipple is also an indicator?
It can be an indication of breast cancer, especially a bloody nipple discharge. And actually, some persons who present with that stage 0 breast cancer, that's how they may present as well.
Interesting. Ladies, please listen. I'm curious, what about men, Doc? How do men check? Because men have, I mean, the instances are rare, but... Yeah,
so we also recommend that men do their breast self-examination. Most of the evidence, though, focuses on women. And I should mention for women, especially women who are still menstruating, that the breast self-examination should be done in the first few days after the end of the period.
Gotcha, because the breasts get swollen and... That
is correct.
Okay,
in the period.
Okay. All right, so right hand with left breast, left hand with right breast, round and round in a circle under the arm with the pad of the fingers, and check the nipple as well to see what's going on. Where are you from, Doc?
I'm actually at the Breast Health and Oncology Care Center at the Angela Memorial Hospital, and I also work at the Kingston Public Hospital. Okay. Thank you for coming in this morning. Thanks for having me. Breast cancer, take care of yourself. That's what happened this morning. Dr. Jason Copeland, oncologist, Breast Health and Oncology Care Center, Jamaica.